up, everybody? Welcome to today's episode of the BeMe podcast. I'm your host, psychiatrist Dr. Taiwo Alonge, and we're honored to have the opportunity to speak with BeMe's very own Dr. Amber Childs. Dr. Childs earned her PhD in clinical psychology at the University of Tennessee, Knoxville, and completed her doctoral training at Harvard Hospital, specializing in child and adolescent services. Dr. Childs is an award-winning, nationally renowned child and adolescent clinical psychologist and a professor of psychiatry at Yale School of Medicine. At Yale, not only is she one of my colleagues, she's a director of training for doctoral internship in clinical and community psychology and co-director in Division of Quality and Innovation at the Yale New Haven Psychiatric Hospital. She's a founder and co-founder of 3 ventures at Yale related to measurement-based care, eliminating racism in the workplace, and youth mental health. At BeMe, Dr. Childs is a clinical strategist. As an innovator and transformational leader, she brings endless expertise and deep experience improving equity, access, and mental health outcomes for youth through data-driven quality improvement and cutting-edge digital delivery. I'm so lucky I get to have a double dose of all of her awesomeness at Yale and BeMe. And I'm also so excited all of our listeners get to hear and learn from Dr. Childs today. So with that said, I'll stop talking for a second. Amber, anything else you'd like to add before we get started?
Thank you so much, Taiwo. I am so excited to be here. And I have to say, I am just equally impressed by all of the clinical and research acumen that you bring to BeMe. So I am thrilled to be double dosing it with you as well. What's interesting is sometimes when I hear my bio read aloud, even though I've sort of thought these things through, I'm always like, wow, is that really me? And it is me. And I say that just because I wonder if there are people who might be listening to this, and certainly I would consider myself one of those people who is probably doing so many things that are inspiring to other people and making an impact, and they themselves might not necessarily see it and soak it in and recognize it all the time. So if you're listening, you probably are one of those people. So maybe take a second and soak some of that in for yourself. I am so excited to be here and to jump in to a conversation with you.
Wow, ancient inspiration, y'all. If that's not an impressive background, I don't know what is. But we have a lot to discuss. So before getting into it, on our Being Me podcast, we like to have our guests tell us a little bit about their teenage selves. So Amber, tell us a little bit about you as a teen. Did you have any nicknames? What did you do for fun? What activities were you involved in? Who did Amber imagine herself being as an adult? And really, what were you like as a teen?
We could probably spend the entire podcast right here. I actually like thinking back to my teenage Amber self. So in my family, my nickname was actually Amos. And so that was the name that I was called. But Amber, that was my business name when I was in middle school and high school. And I just explored a range of different activities. I was really lucky growing up where I had a chance to try lots of different sports. And the sports that I tried on that I really stuck with were soccer. And in order to be on the varsity soccer team, it was this sort of understood expectation that you were also going to participate in cross country. Now, I am not the type of person who in the past would think about running for fun, but I have to tell you, joining that cross country team was one of the most challenging, but also rewarding experiences. The people that I connected with on the cross country team, and I have to say my favorite parts were not the practices, they were the bus rides to and from the meet. But the people that I connected with doing this incredibly intense sport were relationships that I kept for a very long time. So I really enjoyed that. And I also explored dance and a little tiny bit of theater. I think I had like a part as a radish once in Peter the Rabbit as a play. I just kind of like explored around. As a teenager, my high school yearbook superlative, my now husband and I went to the same high school. And our yearbook superlative was most non-conforming. And if I had it to do over, which I would do, I would write back to the yearbook team and say, I think you might mean most authentic. And here's why. I don't think I realized that I was doing this kind of work at the time, but I think now I would probably name it advocacy and like an exercise in authenticity. So I went to school in Georgia, in high school in Georgia, and I learned that there were usually no girls of color in the pageant competition. And I'm pretty sure at that time, I think this is true, that there had never been a girl who had won who was Black. And so I made it my mission, and I had never done a pageant, had not gotten anywhere near something like that. But I made it my mission that I was going to be one of the first Black girls to win that pageant and come in and sort of disrupt that process. And even in the yearbook, they were like, she wanted to add more diversity to the role. And I was like, no, I think I came stomping through saying, we need representation. I think I got like a bunch of signatures at one point when there were no girls on the football team in high school, a petition to try to join the high school football team. At one point, there were a lot of girls that were being sent to the front office because the shorts that the girls were wearing to school were considered to be too short for the dress code. So I started this whole trend where we were in a military town where I took my dad's old BDUs, which stands for like battle dress uniform, pants, and I cut them off into like long shorts that went down to the knee and a little bit below the knee, and paired them with these almost semi-crop top shirts and then like tons of bracelets and really colorful Chuck Taylors, and made this like a little trend that people were wearing these around the school. And we were sort of kind of railing against some of those different rules and regulations. So I think I was doing some advocacy work as I look back on it, and people sort of thought about that as non-conforming, but I'm going to say it was me being super authentic. So that was me as a teenager.
That's awesome. I love this question because for a lot of the guests that we have on our show, you can really almost map out who the person was as a teen and where they're at today. And I think for you, it's so clear. I mean, with respect to advocacy, kind of diversity, but even more than that, just being so authentic shows up in really all that you do. And I know you mentioned that you had a nickname, but Amber was business, and we'll kind of get into a little bit of business. So I mentioned before that we both work together at the Yale School of Medicine, and you get to wear so many awesome hats here and do really, really important work. I'm a big fan. I know after today's pod, you have many more. Can you share a little bit about your journey, how you got to be the awesome clinician, innovator, entrepreneur extraordinaire that you are today? Tell us a bit about your why and about the work you've done at Yale and throughout your career.
Absolutely. So first, I'm going to say I had no idea even about the field of psychology until I became an undergrad. I am a first-generation college student. My sister is the person who taught me how to apply to college. She helped me with my FAFSA. And the reason she was able to do all those things is because she taught herself how to do those things. And we were really, really fortunate because we grew up with two incredibly supportive and very successful parents who wanted us to be able to step into a different sort of dimension of education. I will say my mom actually went on to get her master's degree, and she was getting her master's at the same time that I was. So that was a really special thing. But I didn't know about psychology at all. Really, the objective was like, how do we get to college? And so I had seen, this is not a joke, I had seen before I was going to like my first week of undergrad, I was going to be moving into the dorms, this Nicole Kidman movie called The Interpreter. And so I was like, oh, well, I guess I'm going to major in, I want to be an international interpreter. And so I'm going to major in these different languages, and that's going to be what I do. And I was very different from my sister, who read a book by Ben Carson, who I know is a figure who is perhaps now controversial, but she decided right after reading this book written by this Black neurosurgeon that she was going to be a doctor. And she stuck with that her entire life. I wasn't really sure what I was going to do. So I started taking these intercultural communication classes when I was in undergrad. And I remember the professor, he wrote up on the board this quote by Michel Foucault. I will never forget it. And it was, what if what you believe to be true might be otherwise so? And that really, really stuck with me because I was thinking to myself, wow, there are so many different frameworks that people are bringing to the world and to their experience, how language helps them to express different emotionality and express different parts of their culture and how they connect with one another. And I remember talking about this with him, the professor, afterward, and he said to me, I think you might be really interested in psychology. And so that actually led me to transfer schools to go to a school that had a really powerful psychology program. And so that's kind of how I landed within the discipline. But when I was in fourth grade, I remember having a parent-teacher conference where we actually used to meet with the teachers before our parents came to talk with the teachers about what was going on. And I remember my teacher saying to me, we usually place you at a table where you can be a good influence on the other kids who are sitting with you. And I remember that very clearly, and that there was a kid who I really connected with who was oftentimes getting sent to the principal's office. And I remember he and I would just try to have conversations about why he was doing different behaviors, what he might have been thinking about when he was doing them. And I don't think I realized it that time. Certainly, I didn't have the language for it. But I think I was always drawn to this idea of trying to understand someone's experience rather than just to condemn that person's experience. And so I think there are these little sort of breadcrumbs along the way that sort of led to this culmination of my now being in psychology. But sort of at a higher level, I'm a child and adolescent specialist. And I think that's primarily because for me, there is such hopefulness about youth and about young life. And there's such, I think, an energy around the promise of what someone can become. And it really is an honor and a privilege to think about the very small ways that we can interact with someone that can really change the trajectory of their lives, to really be a small piece of that. So I think that's part of why I'm really drawn to the clinical work, really drawn to that population. And then thinking about the sort of innovator entrepreneur piece, I am a person who lives my life on 1.75 speed. And so while I'm so lucky to be working in this academic setting where we have the opportunity to really investigate how things are related, how things work, to really get behind the science of making sure that we are both honoring people's lives in their process and helping them to live their best lives, I like to do that fast. And so when I come up with an idea, I feel really passionate about it. I want to get people behind that. And so I've started to dip my toes into this new space and have been really finding myself at home here. It feels like kind of putting on like a good sweater that you just didn't know that you needed. So yeah, that's a little bit about why I do the work that I've done and sort of maybe a roundabout way to the journey.
Yeah. I mean, it's again, like very clear. It sounds like even in fourth grade, people were able to identify and see within you an ability to really connect with people and affirm folks. And you mentioned that college professor in that class who also pulled you aside and said, hey, I think this would be really great for you. For a lot of teens, sometimes things are not as clear as what they might want to become. And then you mentioned also not necessarily going to college thinking that you would be a psychologist one day. And I think that's, really a nice lesson to being open to experiences and listening to people and listening to yourself. So that's really awesome. And then you even mentioning about what you do now as an adolescent and child specialist in psychology kind of leads to my next question. And I guess thinking a little bit about how we as clinicians, innovators, parents, friends, and teens themselves can better show up to support teen mental health.
This is such a good question. One, I think it is the question. It's sort of the $1 million question. How do we help people live their best lives and step into the absolute fullness of themselves? One of the things about youth in particular and teenagers in particular is it is part of the work of being a teenager to start to explore and understand who you are, who we are. And that means that there's going to necessarily be a lot of trial and error and trying things on and seeing what fits and seeing what doesn't fit. But when we're struggling in a way with that journey, I think it can be harder for others to be aware of like, what if this is part of being a teenager? And what if this is a little bit above and beyond? And so I always have this policy of the best way to find out what might be happening with a particular teenager. I'm going to go like really granular at first and then zoom out, is to talk with that person, to listen with that person, and not just listening to their words, but trying to really listen and see what's happening with their behaviors. What are the things that they're trying to let us know, or the things that they're talking to in a variety of different ways? So how can we really listen with a wide ear about what might be going on for that person? And really, I guess maybe what I'm saying is, how do we create space for people to bring different issues to the table? And then I think at a broader level, how do we all show up to support teen mental health? I think the first thing, and I think we really started to see this shift in the past couple of years, but I would really like to see this progress further. The first thing is to believe them, to believe teenagers that they are experiencing depression and anxiety at these unprecedented rates, and that a lot of what is being experienced is not the same as what we would characterize as the sort of adolescent task and the struggle and conflict of understanding one's identity. It is different now for teenagers. And so I think we really need to believe them about that journey in order for us to fully understand what might be happening. And I think the other thing is we have to be able to tap into the youth in ourselves so that we can get creative alongside teenagers. Just because there's something that we think should work from our sort of adult lens or our advocate lens or our grown-up lens doesn't necessarily mean that's the way it will work for teenagers now, but it doesn't mean it's the wrong way. It's a challenge, but I also see that as an invitation for us to get creative and get thoughtful about how we can tap into the wisdom that's already inside teenagers so that they can really help us solve this problem alongside them. Taiwo, I'm off on like 80 tangents. Please rein me in if you need to.
You're awesome. I think your expertise and what you bring to the field is so important, I think, particularly for teenagers, because again, there's just so many ways in which mental health care has been practiced and kind of in these antiquated ways, and adding the creativity to the work, I think, is so important. It's what drew me to the field. And I know it sounds like what drew you to the field as well. So please go off all tangents and we can work with that. So no worries at all. But one question I did have was, last year I saw on social media a New York Times article that you shared, and you had a really, really, I think, powerful quote in there talking about the pandemic, which obviously affected so many teens. And in there you said, the pandemic really just turned up the volume on a soundtrack that was already playing. And we're about 4 years out from the start of the pandemic. And I imagine your quote still rings true for so many teens and their families. I know in my work, I'm working with teenagers and young adults who still feel the very strong aftershocks of the pandemic. And it's unearthed a lot for them that's come up daily in my work. Tell us a little bit more what you meant when you said this quote.
Yeah, absolutely. There were two things that I was thinking about. The first thing is I really wanted to impress upon people that what we were dealing with was not something that was new or that just showed up because of the pandemic. Really, what I was trying to convey was like something that was already happening has been escalated, but we have long needed to really address these issues. And I think I was sort of railing against this notion that adolescence and youth is like a specialty or kind of niche domain. It almost is in some of the ways that we talk about it in our training, right? We're going to specialize in this particular area. But every single one of us, every single person under the sound of my voice right now, either is or has been or will be a teenager. And so this is an everyone problem, and it is relevant at every single point of everyone's lives. And I would often find myself as a child and adolescent specialist really having to convey to people the importance of focusing on youth. And so we really kind of hit the prime time spotlight in a variety of ways when the pandemic hit. So that was the first piece. But the second piece that I was really trying to convey was teenagers, part of the reasons why this is happening are they're complex, they're intertwined. And I think a lot of folks really wanted to simplify this down into the idea of like, it's been because of technology and because of social media. And I was saying things like, well, actually, it's been because of unprecedented rates of deaths at school in a place where we're intended to feel safe related to gun violence. There's the pandemic and disease. There's climate change. There's political strife. Kids are trying to work to manage both their psychological and physical safety. And that is happening in a way that we as a collective are newly wrestling and contending with. And so I wanted to talk about both that idea that youth is not niche. Youth is for all of us. And the constellation of things that are happening right now, I think are really unique. And the pandemic coming in and this thing happening that no one could have anticipated showing up in the way that it did has further compounded, I think, some of the youth experience. And so that's what I was trying to make happen in that, what I think turned out to be a succinct way of maybe trying to describe a really complicated issue.
Definitely. And, with the pandemic, kind of as you were alluding to, it really unearthed a lot of things that were already happening, particularly that affect mental health. And there's this tendency to kind of want to be extremely reductionist or oversimplify what's going on, but being able to talk a lot about the different things kids are facing, whether it's attacks on the queer community from a political standpoint or climate change or school violence or school shootings, things like that are really, really important. And the pandemic really brought that a lot to the surface for everyone to see. And I think relatedly, also shed a light on a lot of disparities that exist in mental health care. And in a lot of ways, these disparities almost existed by design. And it's really clear from the data that we're collectively just not really anywhere where we need to be with respect for where the nation is in terms of addressing health equity and doing right by our teens. And I wanted you to tell us a little bit about what mental health equity means to you. I know it's very near and dear to your heart and your work. And how do we begin to close the health equity gaps in mental health care for teens?
Yeah, this is an area I think you're right about that this is near and dear to my heart. I think we'd be hard pressed to find folks who this isn't a core or central issue for, but someone showed me an image years ago, and I think it's a really powerful image. You folks who are listening to me talk may have seen this, but there is a baseball game that's happening, and there's a fence that's sort of up in between a baseball game and then like a neighboring yard, where if you could be high enough to see over the fence, you could actually watch that baseball game. And then there are 3 different individuals. There is a child who is much, much shorter than the fence line. There is somebody who is mid-height, and if they stood on their tippy toes, they could probably see over the fence line, but it would be hard to stand on their tippy toes for long based on how high the fence is. They might even need to kind of hoist themselves up a bit. And then there's a tall person who is able to see very well over that fence line. And when I saw that image, to me, it explained equity really clearly when they talked about how equity comes in and it provides a platform for each person that is built just to meet that person's needs, that helps them all enjoy the game in the same way, for them to all see the baseball game. So the child would receive 2 or 3 boxes to stand on to see clearly over the fence line. The person who had that midpoint height would maybe get 1 box to stand on, and the tall person wouldn't get a box at all because they don't need a box. And so when I think about mental health equity, I think, who is having the hardest time being able to see over that fence line into their best lives? Honestly, if it was equity, we'd all be at the game inside the stadium, but who needs actually the most support, and how do we get that done? But I think the most important piece is like, what actually makes up those boxes? Because what makes up the box for the person who's standing mid-height might not be the same as what's needed for that child. So when we think about teenagers and what mental health equity means, access is absolutely a part of that, but access to the kind of care and the kinds of services that are actually going to help them engage with the support that they need is part of how that box has to be composed. Access to the people who look like the world, who look more like them, and who are able to appreciate, honor, and value the things that teenager is bringing. Like, we have to think about the boxes that are needing, but the composition of those boxes. And sort of that's how I think about mental health equity. And I guess I've sort of peppered in there some different ideas about how we might begin to close those gaps. And if you're thinking like I am, as I was saying that, like, whoa, that's a lot of work to do to try to find providers who are diverse, not just in terms of their own held identities, but the perspectives that they bring to the table, the science that they use to support teenagers, the creativity that we're bringing to address mental health problems in terms of treatment and intervention, and how do we keep teenagers both engaged and heard and seen? And you're thinking like, wow, that sounds like a lot to do. It is a lot to do. So I'm here to get to work on that.
Yeah, I know that image so well about the baseball game. And yeah, I really just appreciate one explaining the image. And I hope there's a way that we're able to show our listeners that and link it to them somehow. But also even this idea of equity would be getting everyone in the game and knowing that before that happens, there's work we need to do, whether it's providing boxes to help prop people up. I think that's a really, really beautiful way to think about healthcare equity. And kind of thinking about that and thinking about special populations, I'm curious for you if there's any special populations that come to mind. I mean, obviously, as a child adolescent clinician, you care deeply about all teens and their families, but are there any special populations that you might pay special attention to given current gaps that exist in their mental health care and then just mental health outcomes in general, whether they're left out of the mental health conversation or being thought about in the wrong way? I'm curious if any particular populations come to mind or are kind of close to the work that you do.
Yeah, absolutely. And first of all, I love the way you frame this question because it extracts away this notion that child and adolescent is in of itself a specialty population. So now I've like beat that drum as hard as I can. So the first group that comes to my mind are the teenagers who we don't see coming to the table for services. So in my mind, I really think about those folks as perhaps lower income individuals or people who may not have access to the same kinds of providers or constellation of services related to their insurance really, really get thoughtful about low-income youth. Because to me, if we are not trying to serve every kind of youth, then we're really not meeting the task of serving youth. So I think about that population in particular, and it is a population that is cross-cutting. It is absolutely cross-cutting: race, ethnicity, a variety of different held identities. But certainly there is a way in which individuals who are part of that low-income status or have trouble accessing services also represent a particular demographic. We can't necessarily separate those two things, but that's one category in my mind. A second group, a population, is really thinking about youth of color, BIPOC youth. I was reading something actually, and I'll just keep it from a place of I for a second. I was reading something about how Black women, and I consider myself to be a Black girl. I'm a Black girl from Georgia. And I'm not saying woman, although I am a Black woman, makes me feel just so old. But how Black women experience depression shows up very differently, both in terms of behaviors as well as the cognitions, than a different racial group, than how depression has been categorized for oftentimes populations that are quite homogenous in the literature, which are typically white individuals or people who have access to whiteness. And so I think about that same thing with our youth as well. I think about BIPOC youth and about how the lived experience of being a BIPOC youth, particularly on this land, shows up in the way that anxiety and depression, self-esteem related issues, eating disordered issues show up and present themselves. So that's a population I think that really stands out in my mind. And I think a final population, and one that I think is probably on the mind of the nation, are really our LGBTQIA plus youth. Because again, I'm thinking about the intersections between each of those groups. There is absolutely right now potentially someone listening to this who is a low income Black trans youth who needs to be able to find a place to be heard and seen and understood, and to have their mental health recognized, to have their humanity recognized, and for us to be thinking about them specifically. So I think both about the populations, but also about the ways in which these different groups are intersecting. And so that's, I think, the challenge for us to begin to really tackle is how do we not only think about the groups, but how do we think about those intersections, the way that they're interwoven, so that we can really allow for people's fullness and their full humanity to come into how we address the challenges that are ahead.
Definitely. Yeah. I mean, again, you speak about the intersections and intersectionality, which many of us know well, but not everyone. I think it's something worth talking about and listening to. But even just this idea that you mentioned about how classically a lot of things in our field, they might depict certain conditions in a certain way. And folks who might not experience depression or anxiety or ADHD or really anything in a way that fits the textbook, which, in a lot of ways, like you mentioned, was written for a particular demographic, miss out on getting the right care. And so much of what I'm sure you see, and I know what a lot of what I see is working with clients who sometimes carry diagnoses, and you're like, whoa, that's not right. That's not what they're experiencing. And recognizing that oftentimes that ends up being someone, like you said, who might be low income or BIPOC or queer or kind of not fit the kind of classic normative mold. So yeah, I think it's so important. And I think particularly in talking about health equity, like you said, it just brings it to the surface and it's so important.
Absolutely. I think one of the big ways that often shows up in the language that's being used by providers in conversations and tables that I've sat at is like, wow, this person's being really non-compliant. This teenager is really not following the rules. They're not doing anything that we ask them to do. And so I really try to introduce into the conversation, what about what we're providing is making it challenging for this person to feel like it's a good fit? And how do we think about it from that framework? Because I do think you're right, Taiwo, a lot of the times in my experience, when a person isn't fitting into the frameworks that already exist because they've been designed with a very narrow scope of reference, the idea is something is wrong with this person, not something is wrong with the framework. And so I think that that's also one of the, again, challenges, but I think invitations and opportunities in the youth space for us to think about, both from a treatment standpoint, from a diagnostic standpoint, all the different ways that we think about mental health, is how do we actually think about the framework itself and start to rework that as opposed to trying to rework the people to fit in those frameworks. That to me is a much more empowering way to try to go about this work. I remember a kid who I worked with many years ago that was seen by the staff as being non-compliant, not following the directions and rules. And I remember pulling this kid into a room once after we had seen them not adhering to some expectations. And the kid gets back there and automatically starts rolling their eyes at me. And I said to them, let's just have a seat. And I said, you are not in trouble. You are not in trouble. And the kid immediately started to tear up. And I said, help me understand what's happening right now. And they were like, well, I just knew for sure I was going to get in trouble. I was like, I could see that you're trying to let us know something important. And I think that we've been missing it. I think we've been missing it because we've been focusing on what the rules are and what the guidelines are and what these expectations are, but you're trying to tell us that something is not working. And this was the first time they had the opportunity to say, this was their way of expressing, I've been wanting to draw people close to me. I've been wanting to bring people in, but the way that I'm doing it is actually getting people pushed away. So again, I think there's a powerful opportunity for us to really rethink the frameworks and really start to step up to the plate.
I really like this idea of rethinking the framework and how so often we're trying to almost like force people. It's like putting the square peg in the round hole, and it doesn't work like that. We need to be more flexible for the different kinds of people we're working with. And that really ties into this next question. Thinking about mental health care, there's a way that it's been done for several decades, if not longer, whether it's traditional forms of therapy, medications, different care settings like offices, clinics, hospitals, or even the way we go about diagnosing and evaluating people. And, out of abundance of caution, oftentimes our field with respect to innovation and change can be very, very slow. And it sounds like I say that in a negative way, and I'll kind of reserve my comment. It's not my interview, it's yours. But I'm curious, for you being an innovator and an entrepreneur in the mental health care space, what does it mean to you, and how in your career have you balanced moving fast while also following and sometimes waiting for the evidence and data?
This is a really tricky balance. Challenged by this, actually. So I said I live my life 1.75. I even talk fast. I remember someone saying to me a couple years ago, they were like, you work really fast. And in some ways, I almost heard it as this negative of like, oh no, I'm not working at the right pace for everyone. But I think part of what sits behind that is this urgency. As we said, if we're going to rework these frameworks and kind of introduce a new way of thinking, we have to do it quickly because we're already behind the ball. So I think a couple different things. I really prioritize making sure that whatever we do, whatever I do, is grounded and anchored in the best available science. And I do that knowing that the best available science is also missing some really key pieces. It's missing key voices, it's missing key experiences, and it's missing a full representation of everyone's humanity. So in some ways, when we are applying what we know to be the best available science, and we're using that science with a person who doesn't fit the population that it was tested on, we already have to do some level of innovation and guesswork and testing. And so I kind of take that same level of application and apply it, I think, to the digital and innovation and entrepreneurial space. How do we preserve what we know is cross-cutting? And then how do we work with calculated urgency to apply those learnings, but in this new way? And how do we give ourselves some space and room to discover something new? And being able to discover something new is not without some level of risk. But I think if we do it in this way that really anchors itself to what we know is supported at least by some science, then we're moving toward the right direction.
Yeah, there's things about the kind of old and traditional way of doing things that have been effective and beneficial. And then there's things that we kind of see do harm or do kind of elevate the risk for some people. So being able to do something innovative is almost by necessity, as you were saying. I think you really laid that out so clearly. Related to that, you mentioned digital mental health interventions a bit. And I'm curious what role you think they might be able to play in kind of helping address our current youth mental health crisis.
I love this question. This idea of digital mental health, the more and more I think about it, the more I think that it's actually phrased that way for grownups, for people like myself who grew up as technology itself was unfolding and starting to establish its footprint in the world. I think that the way that teenagers probably think about this as mental health interventions, and we put digital in there just so that we have a language to help us understand what's happening. teenagers need for their interventions to come in the format that matches the way that they engage with the world, and not just the way that they engage with some abstract global world, the way that they engage with their family members and their friends, even in their own house and even in their own space. I find myself now doing this where if I need to tell my husband something and I'm upstairs, I will text him a message or I will call him. Everything about the way that teenagers live is digital. So I think in some ways we have to start dropping that off of the nomenclature and start thinking about it as like mental health interventions. And if we think about it that way, I think that then opens up the aperture for us to say, okay, how might we design this differently to fit youth? And I will tell you, in my mind, and this is just my opinion, but also I feel like it's a really good opinion, is we cannot use the strategies that have been tried and true and have been known to work for adults and think that those same things are going to apply to youth. It just doesn't work that way. I remember telling someone on the BeMe team earlier today, imagine if you were going to your school homecoming dance or your prom, and one of your grownups, your mom, your aunt, or your dad, or whomever, was like, all right, you're going to wear my prom or homecoming outfit from 30 years ago. I would be horrified about that. It probably wouldn't fit right. I'd be trying to make it work. Even if we tried to get that thing tailored and cut and fit, it just wouldn't be the right fit for me. And I sometimes think about digital interventions in that way, that we sort of take this template that has worked well for adults and we try to maybe put some alterations or tailoring on it. But a lot of times we're just like, wear this same suit and hopefully this is going to work for you. So interventions have this opportunity to really come in and support the way that healthcare is going to be delivered, these digital mental health interventions. But I also think the place that they have, we haven't really fully tapped into that. And that's part of what BeMe is doing, is to say, we're not only going to use that old model, we're creating a new model that actually will be the right fit for you. So teenagers can come and buy something that's bespoke, right, for them.
Yeah. As you talk, I'm imagining this like tension between the old guard or adults who are saying, oh, this is the way people are supposed to function, and the new generation and teenagers, Gen Z, Gen Alpha, and understanding that the digital world is very much their world. And this language around digital mental health intervention versus a mental health intervention, and how for teens, it's just mental health. As for us, it's digital. I think it's so critical to kind of point that out, and why I really love what we're doing at BeMe in terms of inviting teenagers into the room as we think about how we're designing our product and our application, because we need them in this space because they're the experts in some ways, and we're trying to our best to help them. And I think you really laid that out beautifully. For me, my next question is thinking a little bit about your trajectory. I know for me in my training, being a mental health provider, they teach me really well how to be in session with clients and be very effective in those sessions, in those spaces. And I can imagine that's your experiences too, but I would love to hear what drove you to approach mental health care from different angles, not just in sessions with patients, but being a training director, being a supervisor, being a health systems leader, being an innovator, an entrepreneur. What really kind of made you want to step out of the office for some time and really do some work to help address mental health in a different way than you might have learned kind of in your training?
This is going to probably sound cheesy, and I already feel bad about that, but I can only be who I am, so I'm going to go ahead and say it. I honestly feel that I was being, not in a religious or spiritual way, but I was being called or driven or really pulled in this direction. I have always felt like there was a way in which these different pieces and these different roles were going to come together into sync. And so for me, really partnering with BeMe and starting to transition into applying a lot of my work and thinking in industry has really, as I said before, it's been like finding that sweater. It's not only like finding the sweater, maybe it's like finding that really good winter coat that fit just right. And it even has like $20 in the pocket of it. You're like, yes, this is perfect. So I would say my approach to mental health care from just like a broad angle is really about this idea of not directing someone's process, but observing, bearing witness, and also holding and creating space for that person to undergo that process in a way that's going to allow them to flourish. And to me, that is a tremendous job, task, and responsibility to try to hold and create that space that I was talking about. And I absolutely don't take that lightly. What that functions as is this sort of cross-cutting mechanism that I think is what I draw on in working with an individual client. It's how I think as a leader. So I, as a leader, think about bringing together incredible talents and experts who I know are going to be able to get a task done. And my job is not necessarily to direct or drive or force, but it's really how do I create and hold a space that will allow everyone to bring the top of their license, the top of their thinking, the top of their creativity, things that maybe scare them that they haven't necessarily explored, and how do we bring that to bear on a shared task? I think about that as part of the training directive. So all of the trainees that come to work with us, we are so lucky. Our trainees are phenomenal individuals. And part of the work, if we think about that stage of training, is like you're in the adolescence or young adulthood, if you will, of your career. And so my role is really to try to hold and create space for that person to really explore the edges of who they want to be, what they want to bring, and the influence and impact that they want to have on the world. And I think about the same thing in terms of innovation. It's not necessarily about the mark that I specifically will bring, because I believe that when we as a collective, as humanity, or as all of these teenagers can bring together each of our own individual superpowers and passions and drives, we can create something together that is like nothing that exists in the world. So I think about innovation in that same way. And my role is as a person who sort of helps to create and cultivate the space for that to happen. So I think those are the cross-cutting features about how I think about mental health care, leadership, innovation, and how I think a little bit about training.
Yeah, you have a very deep bag. And when I say that, that might sound foreign, but I'm a basketball player, and we talk about players having a deep bag, meaning they can either dribble really well, they can shoot the ball, they might be a 3-level scorer, they can shoot threes, layups, post-game, mid-range. I think of you in the same way with respect to mental health care delivery, innovation, systems, thinking about outcomes, leadership. You're a 3-level scorer in the mental health space. And one of the things that's in your bag is measurement-based care. And I know for one of your ventures, MSelect, it focuses on this in particular. And I would love to hear a little bit about what measurement-based care is and how you apply it in your work.
Yes. Measurement-based care is collect, share, act. It's collecting the person, or I'm going to say the word patient just because that's the language that I typically use when I'm thinking about MBC in the health system. But it's collecting patient-reported data about what they say is happening in their mental health treatment. And so if you want to talk about reworking a framework, in psychiatry and behavioral health, a lot of the really old school way of thinking that is definitely present, I think, in spades now is what the psychiatrist or the psychologist or the provider says is happening. And then the patient is going to do what we say they should be doing next, right? So MBC is collecting what the patient says is happening, sharing that data back to them so that we can get curious together about that person's experience, how it is a fit or not to the data, but most importantly, then acting together in collaboration with one another on what those data say in line with the person's subjective experience to make meaningful decisions and changes to care. So in that way, really is this patient-centered practice of making data work hard for us and making ourselves as providers accountable to the wisdom that's already inside of people so that they can be empowered and so that they can take that as a template for themselves and in their lives. Now, a lot of people think that measurement-based care is slapping a PHQ-9 or a GAD-7 or some standardized assessment in front of somebody and looking at that total score. But what I'm talking about is, again, a reworking of the framework of how we think about data and how we think about the collaborative process. And so that is why MBC is so important to me. And I like to think about those principles, again, as cross-cutting. We don't necessarily have to be doing measurement-based care for me to be wanting to put the patient voice at the center. And so for us, that would really be the teen voice at the center. That's really how MBC operates when you're doing the real clinical process of measurement-based care.
Got it. And two other things that are in your bag are diversity, equity, inclusion, and anti-racism work. And These are both very important disciplines to me. And I'd love to hear how you work both of them into the work that you do daily, how this is developed for you and why you might think they're important. And also what relevance they might have in the work that you're beginning to do and even BeMe's mission as a whole.
So I will say that I am the person who does not have the privilege to not be thinking about anti-racism or diversity, equity, and inclusion. And in fact, there was a little piece of time where I really tried to, I don't know that I consciously did this, but I found myself almost hesitating to become actively involved in the DEI, the diversity, equity, and inclusion and anti-racism space from an initiative standpoint. And in some ways, that was really just my wanting to sort of protect my own peace, because it is a very taxing part of my work portfolio to do. And then the other part of it was just sort of internalized notions about what it meant to be a really successful faculty person. And I got concerned that those kinds of initiatives were not as prioritized as other parts of our academic portfolio. I've done a lot of work around that, and I've realized that my being who I am and showing up in different spaces is actually part of the work. That is my sort of continual advocacy and anti-racism and DEI work, is just myself being who I am and showing up at different tables, letting my voice be heard and letting my ideas be out there for consideration, and then serving as a model for other people who might observe that to be able to do the same. So that's part of it in a continuous way. But what I have done, I think, in the past couple of years is really taken up more strategic initiatives around this and making sure that as we know there's this problem of needing to have more diverse, and I mean that broadly, right? Race and ethnicity as diversity, but also ability status, sexual orientation, gender identity, as we try to shape the field of behavioral health to look more like the world, we need to also make sure that the people who are training those individuals not only look also themselves like the world, but they're able to engage in racially and culturally responsive clinical practices and supervisory practices. So I've really kind of taken up that particular part of the mission. And in terms of the relevance to the work at BeMe, I think diversity, equity, and inclusion, anti-racism is the work. It is inherent to everything that we think about in behavioral health. And certainly that means it's part of what we think about at BeMe. If we want people to be able to step into the fullness of themselves, live their absolute best lives, we cannot think about DEI work or anti-racism as supplemental. We think about that as core and integrated right out front. And so that's actually one of the exciting things about being on the industry innovation side, is we can move with some pace, right? About integrating these ideas and really seeing them brought to bear in the product, in the experience that teenagers are having as we engage our youth advisory board, the composition of that youth advisory board. So there are ways that we're able to see a lot of that come to fruition in some really rewarding ways and rewarding timelines, more importantly.
Yeah. And just related to that, I know you've been with BeMe for a little bit, but you've already impacted us in such a dramatic fashion. And I'm curious to hear about some of the things that excite you about BeMe, and also kind of, if you're able to share broadly, what are some of the things you're working on and looking forward to on our app in the year to come?
I'm excited that BeMe is like a framework changer. So that already was the thing that I was admiring about BeMe before I had the opportunity to join the team, was they are not thinking in the same framework. They are reworking the frame. And that to me is the big sign and signal. Now, there's a lot of exploration and opportunity for us to continue to refine that, but that's also part of the challenge and the journey. So I am 100% here for that. I already know that BeMe has in its roots and at its core the desire to make sure that teen voices are right at the center. And so I'm excited about continuing to grow that vision, introducing new ideas for teenagers to have a lot more choice about what it is that they're seeing and what it is that they want to have happen in their lives, so that they recognize that not only is it that I'm doing something that's benefiting me, but what I bring matters, and I'm getting things back to me that reflect what matters most to me. So really, I'm looking forward to continuing to grow that. And I'm also just really looking forward to being in the company of folks who themselves have that bug that we talked about earlier, where, you want to do things with urgency. You want to do them carefully and deliberately, but not wasting any time. I mean, that's my people. And so I'm excited to be also in connection and in community with you, with the team. I'm excited to be joining that.
We're excited to have you. And one more question for you, and an easy one, but this episode feels very much like a primer to Amber Childs, to Dr. Amber Childs. And I'm excited to have you come back to kind of follow up on a lot of these things that we talked about today. Before you go, any advice that you might have or parting words you might have for our teen listeners today?
Can I say a cheesy thing? I'm going to say two cheesy. Well, actually, one of them is like not cheesy at all, but the first one is. So the first one is to be who you are, because everybody else is already taken. So just be the fullest version of yourself. And then the second thing I would say, I heard this earlier this week, and this really shook my whole everything. I was shook, I was gagged, all of it. This person said, rather than changing who you are, change where you are. When you find out that the where doesn't fit your who, change the where and not the who. And that to me unleashed doors. I was like, oh my gosh, this is transformational. So be who you are. And when you are at a place where your who is not appreciated or valued or understood, that's a good indication that you should change the where and not the who.
I love that. I actually wrote that down. That's like really beautiful. And I think it even kind of fits the mold. Not even fit the mold because we want to stop fitting molds, but kind of fits the theme of this framework and saying that it's not about trying to adjust people to a framework, but changing the framework to fit people. And I think that really fits there.
Yeah. Thank you, Taiwo. We'll have to find that video. We can link it maybe in the show notes page of this, because somebody spoke to this very powerfully. And the person was also wearing blue lipstick, which is a whole look and a whole move, and I support it.
Well, Dr. Amber Childs, thank you so much for being on our show today. You have dropped so many gems for us. BeMe and the world is so lucky to have you in it. Until next time, this is Dr. Taiwo Alonge, along with our podcast producer, Derek, reminding you to keep being you. Peace.